today I'm here to talk to you about influenza. My name is Jennifer. What is influenza? Anybody know?
Virus.
Well, it's a contagious respiratory illness caused by the influenza virus and can result in hospitalization or death. And your older adults, young children, and those with certain health conditions are at the highest risk of complications. The flu can actually make chronic conditions worse. So it's important that those with chronic health conditions like cardiovascular disease or diabetes actually receive the flu vaccine, because their conditions can worsen if they do get the flu, as well as the flu be 10 times worse for them. What you need to know. The flu is contagious, especially in the first 3 to 4 days. It causes mild to severe illness depending on the strain. It is different from a cold, as in the fact that it's an abrupt onset and it has a characteristically high fever, and it does spread through droplets. Some of your symptoms will be fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, fatigue, and sometimes diarrhea or vomiting. What is the best way to prevent the flu? Well, your annual flu vaccine. The CDC recommends that everyone 6 months and older receive their flu vaccines. The best time to get vaccinated is, of course, in September, because it does take 2 weeks for full protection to occur. There are several different options available for the flu. So if you're not one who likes the IM injection, you can do the nasal spray, which is the live virus. Currently, the nasal spray for this season covers 4 different strands of the influenza. So you've got type A, the H1N1, and 2 types of B that are covered with that. There is an intradermal flu shot that is actually similar to your TB skin test, where instead of going IM, it goes under the skin. It has less of the antigens in it, but it's just as effective. If someone is afraid of needles, there is a jet injector, which uses high pressured air to inject the flu vaccine into you. And if you're someone who doesn't want to receive any part of the vaccine or is allergic to eggs and you're 18 years or older, the Flu Box seasonal flu vaccine is one that does not contain any of the virus, and it does not use eggs in the manufacturing. So it is good for someone who, if they have an anaphylactic reaction to eggs. And then your flu zone is great for our older adults, that are 65 and older, because it has double the antigen in it, so it gives them a higher rate of coverage. Most people don't refuse to get the vaccine because they always think the vaccine makes them sick. However, that is not the case. The flu vaccine itself cannot give you the flu because the virus in the vaccine is inactive. It's not infectious, and like I said, there are some of the vaccines that contain no viruses at all. Well, most people do experience side effects to the vaccine that last 1 to 2 days. So some of your side effects, if you get the shot, of course, you're going to get redness, soreness, and tenderness at the injection site, and you might come down with a low-grade fever. If you do the nasal spray, it's going to be runny nose, headache, sore throat, and a cough. The CDC does recommend that if you become ill after you have received the vaccine, that is due to that you had come into exposure with someone who had the flu, either shortly before you received the vaccine or during that 2-week period of time after the vaccine, because it takes 2 weeks to build up the antigens to protect yourself. Or you were infected with a strain that was not included in your vaccine, or you're just someone who is unable to develop enough antigens to fight off the flu. And there are different viruses that mimic the flu, like your rhinovirus. So some people do confuse the flu with some simple viruses. What are your benefits of receiving the influenza vaccine? Well, it can keep you from getting sick with the flu. It prevents the risk of flu-associated hospitalizations. It is an important preventative tool for individuals with chronic health conditions, and it helps protect women during pregnancy. The flu vaccine has been shown in several studies to reduce severity of the illness in people who do get it. So those who get the flu after receiving the vaccine, their symptoms are milder, and the length of time that those last is a lot shorter to someone who never receives the vaccine. Getting vaccinated may also protects the people around you, those who are vulnerable, and like babies and young children or people with certain chronic health conditions. For our healthcare workers, why it's very important that you receive the influenza vaccine annually. The CDC does recommend everyone in healthcare receive their flu vaccine, but yet there are still many out there who cringe at the thought of actually receiving it. Some of your reasons why may be due to the inconvenience or cost of the vaccine itself, a previous negative experience, or personal or religious beliefs or health concerns over the flu. For the inconvenience and cost, most of your employers are not required to supply your vaccines to their staff. There are some agencies that may not even remind their staff or encourage their staff to get the flu shot. And a lot of times, if the hospital that does offer it, they offer it only during business hours, which is not convenient for everyone working in the facility. And also, depending on your insurance, it could be costly out of pocket to receive it. Your previous negative experience might be either personal or professional. The belief that the vaccine is ineffective, that it makes you sick, or the fear of the potential side effects. Personal and religious beliefs. A lot of people, their individual principle just tends to stop them. There are some religions that people feel that injecting anything foreign into their body is just wrong. A lot of people rely on the anti-discrimination laws to protect them when they refuse. However, depending on what state you're in, the anti-discrimination laws may not actually hold true anymore, because in 2016, California enacted legislation to repeal laws against the anti-discrimination on the purposes of religious reasons to not get vaccinated. Also, North Carolina recently, a hospital there terminated an employee due to them citing religious beliefs to not get vaccinated, and a court actually upheld the termination for that employee. So hospitals are stepping up and making it mandatory for their employees to receive the vaccination. Some health concerns is, egg allergy. Somebody's had a previous reaction, pregnancy, or immune deficiencies. There are different vaccines for different age groups depending on what you're looking for, if you want a higher antigen level or a lower antigen level. It is recommended for use in pregnancy because it protects during and as well as after the pregnancy. The only people that the CDC states that should not receive the flu shot is those who are under 6 months of age, or anyone who has a severe life-threatening allergy to the flu or its ingredients, or if you have a known history of myasthenia gravis. Those are the only things that CDC recommends to not get the vaccine. It is recommended that you talk to your doctor if you do have an egg allergy before you get the flu vaccine. So some reasons to say yes to the flu as a healthcare provider. It can help decrease the number of days that you miss work. It also reduces any type of influenza-related illnesses. It can reduce your chance of actually having to stay in the hospital. And most importantly, it prevents the spread of that virus to our patients within the hospital. So some of the ways that the hospitals or healthcare facilities can improve their increased rates for vaccine is by increasing the access and decreasing the cost, as well as educating their staff. For increase in access and decreasing the cost, the employers can actually offer no-cost vaccinations at all of their locations during all shifts over several days so that all their employees can receive the vaccine. As far as education goes, want to talk to them about the vaccine effectiveness, side effects, and their different options that they do have available. And that is the end. I do have a handout for everybody. It just goes into detail and outlines some of the information I talked to today. And I do have a quick little test your knowledge, see what we know. So, can anybody name at least 3 side effects to the vaccine?
Redness at the site, irritation, soreness.
The CD recommends that who gets the flu vaccine?
Everyone over 6 months.
Thank you. True or false? The influenza vaccine is not recommended for women who are pregnant.
False.
Yes. True or false? Healthcare providers who do not vaccinate are at greater risk of getting and spreading the virus to patients and other staff.
True.
And as a healthcare worker, you don't have to answer, but just this is something to think about. As a healthcare worker, do you feel that it's important to receive the vaccine? And if so,